Okay, so this video is focused about the focus of this video is on some of the equipments or instruments that we use when we're doing vital signs or observations. So with me, I have a BP machine, I have a thermometer, I have the pulse oximeter, and I have my second watch. So I'm going to go through each one of these, trying to explain to you how we use them and how we reach the results. So last time when we had a classroom discussion, I did promise you to say I'll show these equipments or gadgets to you so that when you are going on your clinical placement, you will know exactly what we are trying to talk about and how to use some of these things. So just to explain a little about the vital signs. So we said vital signs is an umbrella word that hospital or healthcare personnel will use when they are talking about the respiration, temperature, pulse, blood pressure, and physical appearance of a patient, client, or person. When do we do these vital signs? So number one, we do it on contact, meaning as soon as a person comes to you or you go to them, you do the vital signs for them to stand as baseline data or baseline vital signs. Then we do vital signs whenever necessary, and we do vital signs as per routine, depending on the condition that you are, the person is having or the clients that you are taking care of. So in hospital setup, the routine vital sign examination that you can have, sometimes they can say we do 4-hourly observation, sometimes BD, which is twice daily, sometimes maybe in a surgical ward it's just in every shift, where you know and you're confident that the person is okay. Maybe they're just staying in for traction, there is no signs and symptoms of them having infection and you're not concerned. The doctor may prescribe to say we are just doing vital signs in every shift, so you only do vital signs once in your shift. If you are looking at after or taking care of a critical patient, the vital signs that you do, or the length in between the vital signs, is shortened. So you do them more frequent. You may find yourself doing every 15 minutes vital signs, depending on a patient that is in front of you. So where you are not clear, ask. You can ask on this platform. Type in your questions in your comment section, or you can ask when we are having a classroom discussion. But then for you not to forget, it's better for you to put your questions in the comment section. So with the temperature, we did say there are various types of temperatures depending on the site or body parts that temperature is being taken. So one that we know that is something is the type that we usually use, or the type that most people know, is the one that we do under the armpit. The other type of temperature, there is oral temperature, where you put the thermometer under a patient's tongue for you to take the temperature. The other type of temperature is the tympanic, where you use something like a gun thermometer. It is pressed inside the person's ear towards the tympanic, and you click on the button for you to get the temperature reading. It will beep, you know that the results are ready to be read. The other type of temperature is a rectal temperature. So for rectal temperature, you make sure that you use the cups or probe covers that are designed for those thermometers used when we are taking a temperature per rectal. That probe is supposed to be one-time use only. So meaning immediately you finish taking this temperature, you need to discard and clean the thermometer, ready for the next person to use. This rule applies to all the equipments that we use when doing our vital signs. Whenever you finish using, you are supposed to make sure that you clean and leave them safe for the next person to handle. So when you go to do your own vital signs, because you're not sure, even when it is said the equipment is supposed to be left clean, make sure you clean your equipment before you go to your patient. This is just a safe practice. Not forgetting your hand washing. It's in between patient to patient, and whenever you start your procedure, make sure you hand wash. For vital signs, there is no need for you to put on an attire, apron, and anything. But then, depending on the person that you're looking after or you're caring for, it may require you to wear PPE, which is personal protective equipment. If you're working in an isolation ward where there is a respiratory tract infected person, it may require you to even wear a mask to just cover your mouth and nose to protect yourself, in as well as the pinny or the apron. It goes without telling you to like the video, comment, share, subscribe, and all those. So I have a mercury thermometer. They're not being used this time around, because this time around we are using those other ones that we just click on the on and read. I will put a picture. There is a picture. So that picture is the thermometer, is a picture of the thermometer that is commonly used in our hospitals today. So, and I'm sure you've taken a child, you've been sick yourself, and they had used that thermometer. So this is a mercury thermometer. If you look closely on this one, it's not a good one, but then just to give you an idea how a mercury thermometer is. So if you look at it, the mercury broke, so the mercury spilled inside the glass. I'm holding it because I know it is safe to handle. The mercury broke and spilled inside, but then it will look like that. So this end part, the metal part, is what takes the temperature. So when you are putting under someone's armpit, make sure it doesn't go over to that side, because then it means what you are taking is just air circulating in the room. Make sure this metal part stays under a patient's armpit, and we are not doing it over, sorry about that. We are not doing it over the person's clothing. We're supposed to make sure we put it inside or that way. So you may need to take permission and ensure privacy. Draw the curtains. Make sure when you're doing this, you have you're providing privacy, which shows that you respect the patient and maintaining their dignity, because not everyone would want to show their tummy when they're pulling up their shirt or you doing that. If you are a male healthcare assistant, then the patient is not comfortable you doing that, you can just explain to them to say, this metal part is what you need to be under their armpit, hand over the thermometer to them, let them do it themselves. So for this one, it doesn't have the alarm to sound when it is ready. Unlike this other thermometer, I have it, but then because I use it at home with my kids and also it has been misplaced, so we're just referring to the picture. So this other thermometer, it has got an alarm. When you put it under the patient's armpit, when it's ready to be read, it will beep, ting, ting. Then you know it's ready to read. Ask the patient to remove, give it to you, then it will have the number readings on there. That is the patient's temperature. So for this one, make sure it has stayed under the patient's armpit for a full 1 minute. That is the reason why we are having our nurses watch there all the time. So I will, because it's already a second clock, it is giving me the seconds. So from when I press the thermometer in the patient, I will know when the 1 minute is done and get the thermometer. While you are standing there, depending on the patients that you are taking care of, because you've already got the permission before starting your vital signs, so just try to talk about how they are feeling. So in that time, because we are saying vital signs is supposed to even you're supposed to note of the general appearance and how the patient is feeling. So you can use that time to ask them about the pain and if they have any complaints, because that is when the routine vital sign or the vital signs will be completed. When you do the physical check, you're not checking, but then physical appearance of the patient. Are they happy? Do they look like they're in pain? How is their skin looking like? So you can just try to ask them something, create a rapport from there, and you hear what the patient has to say. So you can ask them if they are in pain and ask them to rate the pain. We rate pain from 0 to 10. So we will tell them, if you were to place your pain, where would you place your pain from 0 to 10? 0 being the lowest, 10 being the highest level of pain. Or they will tell you, I think I can put it at 7. So 7, you know that it's they are in severe pain. Would you like pain relief? Yes, I would like pain relief. It is not your duty as a healthcare to give out medication. What you then do, you are going to go back to the nurse you are working with, or the sister in charge, or whoever is handling medication. you are not going while leaving that thermometer in the patient's armpit, because already it's a glass, it can fall off and it can break. So you will just, because you are working with your notepad, getting the patient's complaints and all the parameters that you're taking from the patient. So you will write on top, oh, I'm looking after Alice Wadia, female, this age, bed number, this one. So temperature, pulse, respirations, blood pressure, complaint, pain. So pain already, the patient has given us, it's 7, we'll write 7. Complaints, they are complaining of pain, and they're also complaining of feeling bloated. You will write that patient complained of being in severe pain and bloated, and they want pain relief. You reassure them to say, okay, as soon as I am done with these vital signs, I'll go to the sister who is responsible to give you medication, to tell them you would like some medication or pain relief. I hope it's making sense. So our 1 minute is already done. We'll now read the temperature. So with this one, the mercury is just that it's spilled inside itself, but then it will be evident enough. You will be able to see where the mercury has risen up to, and that's your reading. So if you look closely, there is a tube inside. So inside that tube, where it looks bluish, if mercury was in there, where it will rise up to will be a distinct mark, and you will be able to tell to say mercury has rise up to this point, and that's your temperature reading. If this person's temperature was high outside the normals, we will then ask a patient if they are in extra coverings, or they are maybe under a blanket, politely ask them to remove extra linen, extra jumpers or shirts, so that they are wearing light. By so doing, you're allowing air to circulate, so that it may help to bring down the temperature. Sometimes you can take temperature which is subnormal, maybe temperature below 35.5, this, that. Try to find out why a person who is talking to you, they seem okay, they're having that low temperature. How is their clothing? How is the temperature in the wards, the room temperature? Is this person from having a bath or shower? So those factors can lower the temperature. If they were coming from a bath, then you've seen that, oh, maybe they are just cold. The rest of the vital signs are okay. The temperature is low. They're coming from having a bath. Ask them to put some clothing on and go on another patient. Come back in 15 or 30 minutes, because we know in this time the body would have generated the heat it needs, and the temperature will go back to normal. So we have recorded the temperature there. So how do we take pulse? So we did discuss a number of sites where we can take pulse from a person. So in this video, I'm going to limit myself to talk about just one site or place or region of the body, whatever you may try to call it. So that will be the radial or radial pulse, and the vein, you will find it. So this is a person's arm. This is my arm. So inside the arm, this one will be perceived as the outside of the arm. The inside will be inside my palm, my hand. This is the inside arm. So inside, then outward or outways or outside. So it's inside the person's arm, away from a patient, it will be there. So we are not coming here closer to the where the patient is, but then inside, away from the patient. So on this side, that is where you will be able to find the pulse. So if you try, while you're watching this video, try to hold yourself and locate the pulse on your own. So it will just be there. So we are not in the middle of the arm, no, but then we are outside. We are not on the margins there, just immediately before that margin. So there is where you will find a person's pulse. If you are struggling, tell them to do their thumb like this, because there is a distinct mark where you would say the palms is ending there. So where this black, because I am a dark-skinned, even white-skinned person, they will have a different color in their palms and the skin. So this margin demarcating the palm and the outer skin, if you follow it, it will take you to the pulse. So this is the good landmark. To follow this margin demarcating the palm and the skin, you follow it, that is where you will find the pulse. Always avoid taking pulse with your thumb. The reason is the thumb is well supplied with big blood vessels compared to other fingers. So you might end up taking your own pulse and not the patient's pulse. If you are in a wrong place and you're using your thumb, you will feel like you are feeling the patient's. So I'm able to feel, because I can differentiate to say this is my pulse, this pulsation is from my thumb. So I'm there in a wrong place, or just try go on a wrong place, you will start feeling some pulsations. That pulsation is coming from your pulse, which is being taken in your thumb. So use the two fingers. We have the index finger and the middle finger. So those two fingers place over where we had said you will locate the pulse. You will feel the pulsation. So if you are trying that now, good. So after locating where the pulse is, you're confident, you're sure this is the patient's pulse. I will now look at my watch. If I have my watch there on my uniform, that is why they are made like this. If I'm wearing it, it will be upside down, so that when I look at it, 12 will be there downwards, 6 will be there. Good for me to read the time and then the hand second. So I'll look at my watch and then know where I'm starting from and know where my 1 minute will end. So before doing that, inform the patient to say, I'm going to be quiet for the next 2 to 3 minutes because I'm just trying to take your pulse. Do not feel anxious or agitated because I am quiet holding your hand. It's just that I want to concentrate on taking your pulse. So the patient will give you time to be quiet, maybe 2 to 3. So I've given it an allowance of 3 minutes. For pulse, we are taking 1 full minute. The other minute, we are using it to take the respirations. So that's why you get the permission for a full 2 minutes. So my 1 minute has started there. So for pulse, as it is pulsating, 1, 2, 3. So if it's slow, it's 1, 2, 3, 4. If it's fast, I should be fast in my counting. So it doesn't swing like a pendulum to say, oh, when it goes around 1, that's when I'll count 1, different with the respirations. So with the pulse, as the beating is being given to you, that is how you count your pulse. If it's fast, be fast in your counting for 1 full minute. We never count pulse for 30 minutes. We never count for 15. It's 1 full minute. So I'm there counting my pulse. So I want to be shouting 1, 2, 3. I'll count in my mind and I'll have the reading to refer to later. If it's not clear, you tell me, comment in the comment section, ask me in the live sessions, then I'll be able to clarify or go through this once more. Once your 1 minute is done, you are not going to say, oh, I've finished the pulse. You will continue with the next minute to count the respirations. The reason is, if you tell the patient to say, now I'm counting your respirations, out of anxiety, or maybe a patient would try to play with you, or their people may try to fake their illnesses, several factors and several reasoning with different people. The patient will be anxious, they'll be holding their breath, then breathing, holding their breath, breathing, or they want to make your job easy and try to help you to do it very smooth, but then in doing that, they're not giving you the accurate respiratory rate that you are looking for. So you continue there. After your 1 minute is done, your fingers will stay there, concentrating. Look on their chest. So when I was in school, I was taught what you can do. Take this patient's arm on their chest, because I am standing here, so my hand will be like that while I'm standing here. So while the patient's hand is on the chest like this, when they breathe in, breathe out, breathe in, breathe out, it will be able and easy for me to count their respirations. But then in an adult, or because babies are clothed with so many clothing, you will need to expose them. So in an adult, it's very evident to say they are now breathing in and out. So 1 respiration is equal to a inhalation and expiration, or expiration and inhalation. So you will count to say 1, 2, 3. So we're not saying 1, 2, 3, 4. No, you will have a duplicate or a double number from what you were originally supposed to get. So it's I inhale, exhale, 1, 2, 3, 4. So you are watching the patient's chest up or abdomen, or you can bring their hand closer so that as they breathe in, breathe out, your hand will be moving and it will be easy for you to count their respirations like that. That is the reason we are getting permission from the patient to say we are going to be quiet for 2 or 3 minutes. Again, my eyes was on the watch, trying to make sure that the 1 minute is what I was getting the pulse rate within 1 minute, and it should be a full minute. We don't do it less, we don't do it above. Again, with the normal parameters of all the vital signs as discussed, I'll try to put them in the description box for your reference. So we have done the temperature, we have done the pulse, we have done the respirations. The other parameter that we do on vital signs is oxygen saturation. So oxygen saturation, like we discussed, is the number of oxygen being circulated in the patient's tissues, or in my tissues, body tissue. So the number of oxygen all over me. This is a pulse oximeter. You will find a different type or make of a pulse oximeter. So some of them will have maybe an opening. It will look like a mouth like that. When you squeeze it, it opens for you to push a finger in, then it goes down and take your pulse. So if you know how to use this one, then you will know how to use the rest of the pulse oximeter machines or equipment that there is. So you just press there so that it goes on. So on top there it is written SpO2, then the bottom one it's written a heart over minute there. So SpO2 heart, which is pulse per minute. So pulse is always written per minute, that's why it's saying the heart per minute. When I click there, whichever hands the patient is comfortable with, I will place the pulse oximeter. So if you look closely there are blue lines that are going up and down. So it might not work very well because the batteries in it have been in there for quite a number of weeks. So yeah, so it will be like this. If these blue lines, they're going up, down, then it's working okay. And what you will see on top is the oxygen saturation, and the one you'll see bottom will be the pulse. So oxygen saturation, the units is always in percent. So this one, it doesn't need you to do it a full 1 minute or that. Sometimes immediately you put on a patient, if it's a good working machine, within seconds it will give you a reading. So the normal, we said it shouldn't go below 94%. So if you see that this patient, you are sure that the machine is working okay, this person is even showing some signs of distress, your oxygen saturation is there 85. So it's something that is urgent that needs to be reported to the sister as soon as possible. So unlike the mercury thermometer, this one we said we couldn't leave it in the patient's arm. We're supposed to remove it, secure it before we could leave the patient. But then with this one, you can leave it on the patient's hand so that it may continue taking the reading while you go call the sister to come and confirm if help needs to be given there. And then sometimes patients will be prescribed oxygen therapy, which we can give whenever necessary, that is PRN. So if this person has got that prescription in their notes, the sister would come to you while this thing is on their finger. They can administer oxygen while you are there and make sure that the saturation goes above 95 before you leave the patient on the oxygen. Do not forget to document. If it was 85, you escalated to the sister, document. I escalated to sister this one, I escalated to the doctor. They have put the patient on oxygen, this percent of oxygen flowing. So that's it, gadget. So we now come to blood pressure. I have two machines. I have this one, which is the automatic machine. So I did not connect it because sometimes it may require you to change the cuff. So remember, we have different sizes of cuff depending on the body belt and the age of the patient. So we have pediatric cuffs which are that small. We have longer cuffs for people who have got arms which are huge or they are fat, and we have the longer the cuff, even the diameter will be bigger, that size. So make sure, look at the person that you're going to do the blood pressure on, look at their arms, and you will be able to determine or guess the type of cuff that you are going to use. So with this one, it's easy. You just connect the cuff on there. Some people will tell you it doesn't really matter whichever way you apply this cuff on a patient, but then the right way is where it is above the elbow. This tube is supposed to be inside and in line with the brachial pulse. So the brachial pulse comes that way. So even if you put it in the middle or a little bit that side, this is the right way to put the thermometer, the blood pressure cuff. And before you do that, make sure you physically inspect the arm, that there are no physical rash that you can see with your physical eyes, or visible wounds. Sometimes the patient can be having wounds, then they may not tell you. If they are having rash, it will prompt you. If you can use the other hand, use the other hand. If all the body is having the rash, it will now tell you to say immediately you finish using this cuff, needs to be disinfected, so that you do not expose other patients who are using the same cuff to the rash this person is using. So above the elbow, the tube inside in line with the brachial pulse. So it shouldn't be immediately, but then you can leave 2 fingers from the bending, from where the hand folds. Then that is the right place or position for your blood pressure cuff. Tell the patient to just relax their arms, relax the arm that is being used. They can lean on anything or even a chair. So make sure that you found suitable position for the patient. Sometimes they can tell you we want standing blood pressure, sitting blood pressure, or when the patient is at rest, lying in bed. But then the principle is the same. They're supposed to be relaxed and comfortable. Once I have applied that cuff, I just place on this pattern. It will start measuring. You just let it be. There is nothing that you need to do with this automatic blood pressure machine. It will give you the readings. The top one will be the systolic blood pressure, the bottom one will be the diastolic blood pressure, and the pulse. So remember, depending on the patients that we are taking care of, sometimes they can want you to take manual pulse, meaning you will disregard the pulse here, or you will use it to compare with the pulse that you take manually by counting. So this one is very easy to use. You document everything. So we have documented the temperature, we've documented the pulse, respiration, oxygen saturation, blood pressure, patient's complaints, and the pain. We have also looked at the physical appearance of the patient. If there is anything alarming, we go to the sister and escalate. If you have 5 patients that you need to do blood vitals on, you do not wait until you finish the whole round before you go to report for the wrong reading or someone who is having abnormal readings. Immediately you finish on that patient, make sure you go to the sister. If there is anything that you can help with while they are taking care of this patient, be there before you go to the next. That is how it is, because when you wait, while you wait and go finish your all 5 patients that were on your list, by the time you're coming back, things would have changed, and by so doing, you're endangering the patient's life. So this one is the manual BP machine. So this one is a basic manual BP machine which can be purchased and are used in the homes. So sometimes you may not find exactly what looks like this, but then this BP machine will have the same principles of use and function. So it will have that gauge. So sometimes in hospitals this gauge will be a huge thing like a wall clock. So it doesn't matter. the principle and the function is the same. So we have one tube that is inflating air in the cuff, then the other tube that is coming from the cuff being connected to the gauge. So you need to know these things so that even when you are on the ward, if maybe it was disconnected for whatever reason, you know that what this pumping thing is connected to the cable that is supplying the cuff. One tube that is coming from the cuff going to the pressure gauge is also there. So this can even come out and you just place it somewhere where you are confident that you will be able to look at it, but then it is safe for it to stay there. The other thing we will need when we are taking manual blood pressure is the stethoscope. So that's the stethoscope. So for your own safety, if you're working on the ward and you do not have a personal stethoscope, make sure that you wipe these ends that goes into the ear properly, because you may catch an ear infection from other users. So try the stethoscope before you go to the patient. So if you do that, you are able to hear the sound loud and clear being transmitted in the stethoscope, and you're able to hear. So that's my stethoscope. I have my cuff pressure gauge. I need to make sure that the pressure gauge also is working okay. So the pressure gauge has got this thing that we screw. So we need to screw it to close before we need to start pumping. And when we are finished pumping, we need to release it to allow air to come out. We can see that it's moving as we inflate or squeeze this hand pumping thing. So for us to release air, we're not supposed to open at once like that, because we will miss the blood pressure reading. So you release little by little until you are sure and comfortable with how that hand second is dropping. So how we are going to take the reading with this one, we need to put the blood pressure cuff on the patient's hand. Same principles like we had used the automatic machine. Automatic cuff is the same we are going to use with this one. So I'm just letting all the hair out. So with this one, it will be easy for you, because you just need these two to be the space in between to be in between your hand. So that will be your landmark. Then you go ahead. So I'm having challenges because I'm doing it on myself, but then if I was doing it on another person, it's very easy. Within 1 second, I have applied this cuff. So make sure you leave this gauge where your eyes can see, and it's supposed to be like that, so that you see it's rising up and you will be able to see it coming down. So I'm holding it for you there so that you may be able to look at this one. In principle, tell the patients to relax. Tell them to put their hands straight while they relax. So I'm going to close the screw which is there and start pumping. So the idea is the stethoscope will be in my ears like that. Then this end piece will be pressed there. Before I even start pumping, I'm supposed to hear the pulse being transmitted in this tube. I'm supposed to hear this patient's pulse. We are not using the thumb to support that. We are using our finger, and most of the time we're supposed to maybe just hold the handpiece like that. So if you're having challenges, make sure you locate the pulse before you start your blood pressure reading. So if I have two hands free, one hand will be holding this, the other hand will be working with that. Then my eyes will be glued on the pressure gauge. So one hand supporting that, and I'm able to hear the pulse in my ears. The other hand is working with that. I have placed the gauge where I am able to see, so we'll just demonstrate like that. I'll close the screw there, then I start pumping. So sometimes the patient would even tell you it's too much, it has gone too much. So with the automatic one, it will squeeze and it would be able to determine to say this is too much. And depending on the blood pressure ranges of the patients you're looking after, if their ranges is above 131 something, you are going to, if you're suspecting them to be having high blood pressure, you will pump maybe up to 200 so that you give allowance for the blood pressure reading in case it was high on those numbers. So once I have pumped up to that number, I'll now use this valve to release the hair. I'm not going to open it at once like that, no. So I will do it slowly. So once I'm comfortable with that one moving, so remember, before I pumped hair in this machine, I was able to hear the pulse. Once you have pumped to your full limit, or where you are ending pumping, this pulse disappears. So when you start releasing, the pulse comes back in your ears. So what you are waiting to hear is where you will hear a beating of the heart coming, boom, boom. It will beat so hard and so loud, it will be boom, then goes back to boom, boom. So where it goes loud like that, boom, that's your systolic BP, because your eyes are glued on that one, or I will see it has bumped on 122. I master it in my mind. I continue releasing the hair. It will go slow, boom, boom. Again, it will do boom. Maybe at 75, that's my diastolic BP. So that's how we take blood pressure with the manual machine. So I pump hair up to there. I start releasing. So I'm trying to feel, boom, I feel it, I master. Another one there, I master. So after you get the second reading, it's okay for you to release the hair and let the patient rest. If you missed the first one, and you're not sure you've hit the second one, it's okay for you to close the valve again. Try to push in more hair, because you are trying to determine if you hit your systolic at 60, you won't pump hair up to the pressure, you want to pump it up to 200, you may want to put it maybe at 160. So then you try to release until you get the accurate reading. So that is how we take manual blood pressure handstand. That is how we take the manual blood pressure. So with the automatic machine, it's easy, straightforward, dead straightforward. With the manual one, you need to know what you are doing, understand the principles, and make sure you use the right equipment, which is functioning okay, and apply it accordingly. Identify the pulse. I feel like my camera keeps on moving. Identify the pulse before you begin pumping pressure, so that you do not waste the patient's time by not listening anything, then you keep on doing the same process all over again. Documentation is very much important. Reporting is very much important. So if you are doing 5, after the all 5, if they are all okay, you need still to tell the sister to say, I've done observation on the 5 patients on the ward. Everyone is okay and they are not scoring. No one is complaining, no one is in pain, no one needs a pain relief. Document on each person in their files and hospital notes in the right place. So you just don't go document in the doctor's notes, you document your vital signs there, because the next person who will come, they'll go to the TPR chart or the vital sign chart to look for your results. So document in the right place, or right document on the right patient, making sure that you've asked their name, their date of birth and home address. You are sure that this vital signs belongs to this person. The safest thing to do is, when you are dealing with the patient, before you move to the next, document for this patient, go to next, document, then go and give the final report to the sister to say nobody's scoring, nobody's complaining, nobody needs a pain relief. If it was otherwise, you report accordingly. So I hope it was helpful. I hope I was clear. I tried my best I could. I will leave a link again with the TPR chart that is used back home to just try and show. So I'll use 2 TPRs. So the one used back home and the one we're using in the UK, to try and show how you can document the readings. So that is that. Thank you for tuning in. Share the video, like, comment, subscribe, and yeah.